All too often, ministers come to Parliament to present cold numbers about taxes, spending cuts, wages, pensions, benefit freezes, and make absolutely no mention of the human cost associated with their plans. The never-ending austerity continues to deprive people of good food, housing, and healthcare. It creates hunger, disease, anxiety, insecurity, and mental health problems, huge waiting lists for hospital treatment, and ultimately premature death. I have been in this House now for nearly 2 years. I have never heard any minister explain the ethics of austerity or human consequences of their cold decisions. The paper titled "Bearing the Burden of Austerity: How do changing mortality rates in the UK compare between men and women" was written by 4 renowned international scholars and published in October 2022. It reported that during the period 2012 to 2019, there were nearly 335,000 excess deaths in England and Scotland. The death toll includes over 250,000 men and 84,000 women. The cause of death is austerity imposed by the government. The research methodology behind the paper is well articulated in the paper, if anybody is interested in critiquing it. During the period 2012 to 2019, the government handed billions in tax cuts to corporations and the rich. It also handed hundreds of billions of quantitative easing to speculators and gamblers. This free money fueled asset price inflation and produced a record number of billionaires. However, the same process was not used to alleviate poverty, and the government condemned millions to poverty. By 2019, some 14.5 million people, or 22% of the population, was actually living in poverty. This included 8.1 million working-age adults, 4.3 million children, and 2.1 million pensioners. Since 2010, the government has incessantly attacked low and middle income families. Real wages of workers have been suppressed, and even today, the average real wage is lower than what it was in 2007. Public sector workers have been especially targeted and have received below inflation pay rises. This hits women hard because more than half of the public sector workforce is female. Workers' share of GDP in the form of wages and salaries is barely 50% compared to 65.1% in 1976. No industrialized nation has experienced this rate of decline in the wages of its workers. Low wages result in low savings, and people don't have adequate buffer or resilience for the rainy day. The less well-off have a shorter life expectancy. The cause is not some invisible hand of fate, but the visible hand of the government that has impoverished people and condemned them to early death. Lone parents, the disabled, carers, the unemployed, and those on hard times are particularly targeted by the government. Women make up the majority of Social Security recipients and have been more affected by the Social Security cuts and benefit freezes, which punish basically the poor because they are actually poor. The Joseph Rowntree Foundation has stated that, and I quote, "From 2013 to 2019, ministers chose to reduce benefits in real terms by freezing their value or increasing them by a lower rate of inflation," unquote. If that wasn't bad enough, the government increased taxes on the less well-off as well. In 2010, the government increased the standard rate of VAT from 17.5% to 20%. Inevitably, a greater proportion of the less well-off people's income goes in taxes. An analysis produced by the Taxpayers Alliance which is much closer to the government ideology and can't be accused of being a lefty organization, stated that families in the lowest income categories paid 47.6% of their gross income in direct and indirect tax in 2017 and 18, compared to 33.5% by the richest 10%. Regressive tax policies still continue. The underfunding of public services has condemned again millions, if perhaps, but certainly thousands, to hardship and death. In 2010, NHS England had a hospital waiting list of 2.5 million. By 2019, it ballooned to nearly 4.5 million due to underfunding, and now stands at 7.2 million. In 2016, the outcome of Exercise Cygnus informed the government that the NHS would not be able to cope with the flu pandemic. But the government still reduced the stock of PPE and the number of beds. Too many people have paid for that decision with their lives. The government's taxation, wages, social security, public spending and other policies have inflicted death on innocent people. The paper, which is the subject of the main motion for the debate, particularly draws attention to the gendered nature of the austerity and notes that among poorer populations, death rates have worsened to a greater extent amongst females than males. Yet I have never seen a Conservative budget that explains the gender impact of the government policies. The last budget mentions the word women just once, and that was in November, but nothing actually there really for women at all. So I look forward to the Minister's response and hope that he will refrain from citing the usual gaggle or this or that support that is given to people, because none of that has prevented the death toll, which I referred to. We have just celebrated Christmas, and its message is that thou shalt love thy neighbour as thyself. Yet it is hard to see any of this spirit in the government's policies. They're only focusing on the richer neighbours. So despite all the evidence, the deadly austerity policies continue. Can the Minister explain what the squeeze on low and middle income families has actually achieved? People can clearly see that it has neither increased prosperity nor happiness of the people. Millions rely upon food banks, a tacit confirmation that government policies have failed. School children are going hungry. Senior citizens are forced to make choices between heating and eating. Social squalor is increasing. Austerity has impeded economic development and deepened inequalities. It has increased insecurity and anxiety and the need for health and social care. The underfunding of essential services has denied life to many. During the Second World War, bombings by the Luftwaffe caused about 70,000 civilian deaths. Yet this government has condemned 335,000 people to death, all in the name of some defunct economic ideology. Has any other UK government inflicted this level of harm on its own people? If so, perhaps the Minister will name it. Every deceased person was someone's relative or friend. Millions will live with that pain, knowing that the death was avoidable. What satisfaction does the government get from its austerity policies? I would be grateful to the Minister, who here speaks for the government, to commit to 3 specific pledges. 1, appoint an independent inquiry into the deaths caused by the government policies. 2, redistribute income and wealth to reverse grotesque levels of inequality. 3, ensure that the impact assessment of all bills is accompanied by an assessment of the human consequences of the policies contained in those bills. Thank you.